Reid Depowski. I am a psychotherapist and clinical development coordinator at Therapy Today, Counseling and Consulting in East Lansing. I think it's been really sad the way that college students have been talked about in the media, as if football games and time spent with friends and these parties and things are frivolous. And yes, if we want to talk about the nature of survival and like truly get down to the nuts and bolts of the pandemic, I can certainly understand people's concerns about college students getting together and assuming that risk when they spend time together. But I can really appreciate the grief that college students are experiencing right now, as you all have had so many losses of lifestyles, of once-in-a-lifetime experiences. And so I think it's riding that balance, right, of knowing we all have to be responsible and doing our part, but also acknowledging that it's really hard to make these sacrifices and give these things up for good. I'm so used to my schedule being given to me. Like maybe I have a little bit of control about how I stack stuff, but for the most part, you know how many classes you have to take, you know how many hours you have to work, you know how many hours are expected of you at an internship or an organization or volunteer opportunity. So we're so used to our entire lives structure being given to us. And this is true for adults too. We're given our work schedule. So when that structure is taken away and students are now responsible for getting all of their classwork done online. I have so many students who really don't have a schedule of when they're supposed to log on. It's all on them. So I take an empowering lens from that of saying, what other time in your life would you have this level of control over your schedule? Not to invalidate the stress of this pandemic on completing college, but identifying areas of change, areas of control can really help our mental health. So I encourage students and often create a structure with them of what could your daily schedule look like that helps you build a routine where you feel a bit back on track. You have a normal sleep cycle, you have an eating schedule. These are basic human needs that when they are incorporated into a schedule, we see significant improvements in our mental health and our ability to offset stress.
Hi, my name is Victor Leon. I'm a clinical social worker and staff counselor at Michigan State University's Counseling and Psychiatric Services. Totally speaking, what I've noticed is, as I've been working with students, we've shifted from maybe things that they've come in with to now having to deal with isolation, having to deal with losses that they've experienced in their lives. So these losses can be, there's many different types of losses. So it could be pauses or lapses in friendships due to having to follow CDC guidelines. It could be actual losses in relationships, things that might happen even outside of COVID, but having that extra layer can have a different impact, as well as just physical losses, people dying, whether it be related to COVID or other aspects, as well as having to cope with the anxiety of contracting the virus and just, these changes. So that's one shift that I've seen, is having to prioritize or focus or learn to cope with these new stressors. What we're speaking to is kind of navigating uncertainty. You're absolutely right. Folks are, particularly students, are experiencing, like I said, a different kind of loss. They're losing opportunities, and they're not really sure what's going to happen. And that can be really stressful. And during times of uncertainty, even during these times, it's still important to maintain a sense of structure and a sense of routine, because you still need sleep, you still need to eat, you still need to exercise, and you still need to maintain and engage with others. It's just going to look differently now. So being able to maintain a sense of structure and routine while being flexible and compassionate with yourself. And so compassionate self-compassion might look like accepting that this is the new reality and choosing to focus on what you do have control over. CAPS does offer individual counseling as well as group counseling services or consultation services. And consultation services is something that is open to all students, regardless of where you're at. So what I was going to touch on was other resources that are available on campus. So for example, the Neighborhood Student Success Collaborative, if you go on their website, they do offer pre-recorded workshops on various topics, and you can even request workshops on things that are interested, so such as time management, certain skills that you need help with. So these are additional resources that you can do to kind of help adjusting to online learning, so folks feel more prepared.